So next topic, we have the special projection terms. First, we have the axial projection. It is used to describe any angle of the central ray of 10 degrees or more along the long axis of the body or body part. So if the central ray is less than 10, so the terminology could not still be applied, or the axial projection would not be applied if the central ray angulation is less than 10 degrees. Okay, so basically angulated siya, pero the minimum is at 10 degrees. Kung more than 10 na gani, then we will use the axial nga term. Okay? So next we have the tangential projection. Tangential projection describes a projection that merely skims a body part to project that part into profile and away from the body structures. For example, image on the left bottom, you have the touching, diba? Touching a body part, or the central ray merely skims the body part. Okay, so in this illustration, ang iyang target ani is the patella of the knee. So since the patella is naa siya sa kanmurag corner sa tuang knee, anterior, and then kung imong i-flex ng imong knee, di ba murag naa siya sa corner, so it can be projected tangentially. Next, we have the dorsoplantar and plantodorsal projections. So these secondary terms for AP, these are secondary terms for AP and PA projections of the foot. Yan siya, kaya diba, sa foot nato, the kani siya nga surface is the anterior portion. Pero ang tawag nato sa yaha is dorsum pedis. And then dere, kana sa sole sa atong foot, we term that as the plantar surface. So kung mo enter siya sa imuhang dorsum, mo exit sa plantar, that is dorso-plantar projection. Dere, if mo enter siya sa imuhang plantar, mo exit sa dorsal surface sa imuhang foot, plantar, dorsal, planto, dorsal projection. Okay? Next, we have the parieto-acanthial and acanto-parietal projection. So these are also known as the Waters and then the reverse Waters method. Okay? So central ray, for example, kani sa parieto-acanthial, parieto would refer to the parietal bones. Acanthial would refer to, di ba, one of the skull positioning na landmarks, di ba? You have your acanthion just below your nose. Okay? So, dere, for example, in this image, kaya nasa taas, the central ray enters the parietal surface, exits at the acanthion. Kana siya diha. Okay? And then, balihon nato siya. For example, dili kaya ni patient ang magkulob sa table because of, for example, nasa ubos, because of trauma. So, ang buhaton is to do the reverse. The central ray enters the acanthial nga region or the acanthion and exits dito sa iyahang parietal portion. Okay? So again, kung mo enter sa parietal, mo exit sa acanthion. PA gyapon siya, pero this time it is more specific. Parieto-acanthial projection. Kani, entering the acanthion, exits the parietal, acantho-parietal projection. Okay, so last topic, we have the body habitus. So first, we have the hypersthenic. It consists of the 5% of the total population. This is according to US ni siya nga population. This body habitus is described as having deep and broad thorax, short thoracic cavity, short and wide heart, elevated diaphragm, stomach and gallbladder are very high, and colon is high and wide. So kani sila nga descriptions, they are actually based from the normal body build, which is sthenic. Okay, so when compared to sthenic, we describe hypersthenic. Okay, so again, when compared to the sthenic, the hypersthenic has a deeper and broad thorax. It has a shorter thoracic cavity. It has a short and wide heart. It has an elevated diaphragm. The stomach and the gallbladder is very high, and then the colon is high and then wide. So that is because of the lateral dispersion of the organs because of the fatty materials nga naa sa iyang abdominal cavity. Okay, so kabantay mo when persons are very fat, most of their fats are collected sa ilang abdominal cavity. So once the abdominal cavity will be filled with a lot of fats, ma-push niya laterally ang tanan organs. Okay, for example, the colon will be projected laterally. Okay, mo na ma-stretch siya og ayo, the stomach and then the gallbladder will be pushed upward and pushed upward, and then the gallbladder will be placed at an almost horizontal position. And then the lungs will be shorter because the abdominal cavity has a lot of fats na ma-push niya upward along with the diaphragm. Okay, so as the diaphragm rises, the lungs also rises, and that's why hypersthenic patients have hard time breathing. Di ba kabantay mo sa mga hypersthenic ng mga patients, ang kanang dako-dako na yung mga pasyente, di ba maglisod sila ginhawa? That is because of their anatomy. Okay, so because their lungs are shortened, munang maglisod na sila og ginhawa kay the expansion of the lungs kay pa lateral naman siya, dili na siya longitudinal, and then the lungs dili kay siya paka-expand sa iyahang lateral portion. Okay, so the sthenic, this is the normal build which composes of the 50% of the US population. Okay, it is a lightly longer and shallow thorax compared to the hypersthenic. Ribs are more vertical. The heart is narrow and longer. Thoracic cavity is longer. Diaphragm is not high. Colon slightly lower and more centrally located. So diba kabantay mo ganin na itong hypersthenic, ang iyahang colon is naka-stretch gid og ayo. Ang iyahang transverse colon is halos na straighten na. Next, we have the hyposthenic. Body build niya ani is almost pareha sa ako. Si Kenneth nga Ladesa is sthenic na siya. I think wala man natay hypersthenic sa inyo ha. Both the third year and the second year. I'm referring to the third year and the second year. Okay, this video will be presented for the third year and the second year. Okay, so hyposthenic patients, their thorax are longer. Diba? Kita mo sa kuha, medyo sexy akong lawas. The diaphragm is lower. So that means the lungs is also, the base of the lungs is also projected much lower compared to the sthenic patients. So tag-as gimig lungs ng mga body habitus. The stomach and the gallbladder is lower compared to and closer to the midline. When you compare this to the hypersthenic patient, kabantay mo sa hypersthenic patient ganina, ang iyahang gallbladder is naa the repeat nga portion. Kita niyo akong cursor. And then kung hyposthenic, na siya dapit. Okay, towards the midline na. That's how the anatomy changes based on the body habitus. Okay? So kato kanina tambok manggod, so gaka-push laterally ang mga organs niya. This time, since wala kayo sulod ang iyang abdominal cavity for the hyposthenic, labaw na sa asthenic, the organs are being compressed towards the midline. That's why the stomach kay mutaas po siya, mupadulong po siya sa ubos. Also the colon, as you can see here in this illustration, and also the gallbladder, di ba, ma-push gid siya towards the midline. Okay, so colon lower and close to the midline of the abdomen. So the asthenic, katong mga niwang na kay especially ang mga tigulang na or those who are very ill, for example, na kanang mga terminally ill nga patient nga halos wala nagikaon, na niwang nagikaayo, or those suffering from anorexia. So this is an exaggeration of hypostenic type. Thorax is narrow and shallow. The heart is longer and narrower compared to the hypostenic. Thoracic cage is also longer. Diaphragm is very low. The stomach and the gallbladder is very low and vertical and also near the midline. Okay, so the dangers of asthenic pud sad kung mo increase pud sa danyahang weight, is for example kanina adre sa illustration, di ba? Once ma-stretch ang mga organs, possibility basin niya maglambod-lambod ang mga intestinal linings nila dire. Okay, so if ever nga ni mohang body habitus, so ang imong pag-gain sa weight should be gradual lang, dili tong paspas. Okay, so that's it for module 1, radiographic positioning and then terminologies. So if ever you have any questions, just message me through Messenger, or you can just text me. You have my number, man pod. Okay, so questions, please ask questions. The online platforms is always there, always available. And medyo lisod kay ga-record ako og mga videos. Ga-record data sa atong lecture, especially nga busy kay ko karon. Pero thank you for cooperating with me throughout this process, and we will continue. And I will also continue with your learning processes and schedules. Okay, so thank you for listening.